My job as a United States Senator, and I know this at this table, is to protect the American people and also protect the people that are protecting us. And this, therefore, goes to the people who rendered hands-on service or those that were concerned about those doing this work. So let me go to the Secretary Burrell, to you. In your testimony, you talk about domestic preparedness, and you thanked everyone for the gallant and generous and dedicated work of healthcare workers here. But I was really worried, and I also was not only really worried, so were the National Nurses United. I received a letter from them that really articulated my concerns. What they said to me, and now I quote them, is that the president needs to evoke his executive authority to maintain uniform national standards and protocols, that all hospitals must follow safety-protected patients, all healthcare workers, and the public. They then go on to talk about the personal protective equipment needed, particularly hazmat equipment, and they identified the actual OSHA standard number. My question to you, Secretary Burrell, is do you feel confident that now in the way we are responding, that the doctors and the nurses who are actually touching patients have the protective equipment that they need, that these are national standards for not only the equipment, but the training, so that we have a national response regardless of where someone might appear that needs help? Could you share with us, and did you respond, or did the president respond to the National Nurses United request?
So with regard to the issue of making sure that our healthcare workers are prepared, I think we need to think about it at a number of different levels. The first is in that screening and monitoring, and that is what state and local healthcare workers are doing when they are checking on the people who have come from these countries. Second is that initial frontline worker in a healthcare institution that needs to be able to detect and isolate, ask the right question. If you have a fever, what is your travel history? The next is the level where treatment will occur. And as we describe in our submission, this will be in a more state-by-state basis and where the cases are in terms of treatment. The question I think the nurses were posing was on the category that had to do with that front line. As I mentioned in both my oral and written testimony, at this point, we've trained over 250,000 people. What we need to do now, and that's part of what this request is about, is to make sure that that training continues and extends, and we need to measure it. Because what we are hearing, when we hear from the nurses, we want to make sure we respond. Do they know? Is the training working? Do they feel confident? Right now, we're working with the Association of State and Tribal Healthcare Organizations to make sure that we're going to put in place some measurements so that we can understand they have what they need with training. The second part that the nurses mentioned is PPE, the protective equipment.
Yes.
We are provided guidelines through the CDC in terms of what's needed in terms of training and what to do, but the second issue is access to that. And through the Assistant Secretary for Preparedness and Response, BARDA, we are working with the manufacturers. They are producing 24/7 right now, and we are working with them and working with the states to make sure that those who have the greatest need and will most likely treat get that equipment.
Well, Madam Secretary, let me follow up on this. So do you feel confident that we have, that if Ebola appears, you used in your, on page 4 of your testimony, the Maryland case example. A young lady came in, she took her temperature, she thought she might have it. She wasn't going to go to NIH, she was going to go to either Maryland or Hopkins. That those who would be once identified with the high temperature, et cetera, that they would have the equipment and that they would know how to use the equipment, but regardless of whether they're at a high-tech urban hospital like a Hopkins or a Maryland, an academic center, but could be a community-based hospital in a rural area, that you would be ready to respond to see that they had the equipment and the training.
That is why we are doing the aggressive training that we're doing, and so we want to continue
to
do it.
Do you feel confident that we have this now, or we're in process?
Right now, what we have seen in all the cases that you articulated and all those that have come through, because we are also providing at the border a kit. So any individual that is coming through, which is where the case would originate, actually gets a phone number that they are supposed to call. They get a thermometer to take their own temperature, and so therefore they can.
What I need to get is for that nurse to feel that if she's got to walk into a room and provide the care that she's taken an oath to do, along with the doctors and others that are the support staff, that they're going to have what they need to do the job and that they also have what they need to protect themselves.
That is what we are working to do with all the training. At this point, we've trained 250,000, and the funds that we're asking
But isn't
for will
this
help
what
us.
your money is for? That
Yes,
really,
it's to continue that effort and to
that
make
isn't
sure
this part of
that
the
we measure
public
it.
health infrastructure?
It is. This is the basic, and it's not just
This is
for
not an
Ebola.
argumentative question.
Yes.
I've got to put the public's mind at ease, and I've got to put the nurses at ease. Not at ease, but the feel that we've got their back, and we also cover their back, their arms, legs, eyes, etc. when
With
they
the
go
PPE.
in. Right. Now, I have another question that I've gotten a lot from my constituents, and it goes to our military. What the calls that I got were, oh my God, we're now sending our military in harm's way to protect us against terrorism, but now we're sending them to get Ebola. My constituents were deeply concerned that in deploying our military to do the excellent task that you've just identified, Mr. Lumpkin, that they were going to be exposed to Ebola and that we were putting them in harm's way to get Ebola. Do you believe in your deployment, and if the good general needs to respond, are our military actually going to come in contact with people with Ebola, and are our military at risk of getting Ebola? And are we sending them in harm's way in the same way we're doing it with a bullet, but here we're doing it with a disease?
Thank you very much for the question. I think one of the key aspects here is what I mentioned in my opening remarks, is that DoD personnel are not doing direct patient care of those that are infected with the Ebola virus. We've taken great steps to ensure that our military and civilian personnel receive training before they go, comprehensive training. We make sure that we monitor them while they're there, and we make sure that we have a controlled monitoring situation when they return. But I'll defer to my Joint Staff counterpart, who can, Major General Lariviere, who can go into the specifics of that. Thank you.
General, welcome.
Ma'am, thank you very much. The personnel who are going to be deployed, as the Assistant Secretary said, will not be doing direct patient care. We've instituted 4 levels of pre-deployment training for all personnel who are going, from the lowest level for our transient peoples. Think about air crews who will be just flying in, not getting off the airplane and flying out, graduating up to personnel who will be in country, who will have to interact with Liberian nationals as they go about their day-to-day business. Those personnel will receive training on how not to come in close contact with those personnel, and will also be issued PPE that they will carry with them in the case it's necessary, up to higher levels of training for our healthcare professionals who will be in country at the 2 Roll 2 hospitals, one in Monrovia and one in Dakar, Senegal, who will be there to treat our military personnel both for regular injuries and be able to treat them if they somehow do come and do contract Ebola. And finally, to the highest level of training for our lab workers who are there now testing blood samples as part of the support there. So yes, we've got a complete protection package for those personnel.
Thank you very much. I'm now going to turn to Senator Shelby. I could have asked the same about the protection of our border people and our State Department people, and I'll look forward to you perhaps submitting an answer to that. So we protect those who are trying to protect us.